Next, we will talk about the parental route, which is the second part of the systemic route. It refers to any route of administration that do not involve drug absorptions via gastrointestinal tract. Now let's talk about the parental route. We use this route by which the drugs come into the contact with body and bypass the GI tract. Or we can say parenteral drugs enters the body through the injections and through the tissues and circulatory system. This route can be effective and safe when we prepare and administer correctly because they are aggressive, easily and quickly absorbed into our body. Next is advantages of the parenteral route. First is it is a rapid. It is a useful for the unconscious patient and bioavailability is 100%. So the action of this route is a very fast. This route is used for the unconscious patient and its bioavailability remains 100%. Next, disadvantages. It is a painful, less safe method is expensive. So that means this route is a painful or unsafe if it is not administered correctly. And it is also an expensive method because there is a requirement of a physician or nurse to inject. Next is subcutaneous route, which is come under the parenteral route, used for the arms, forearms, thighs, and subscapular space. This route might be used for the arms, forearms, thighs, and subscapular space site to administer the injections of the medicines. Advantages: absorptions is slow and constant and hygienic. So, absorptions of medicines is slow and constant state. It is a hygienic way to administer the medicines through the subcutaneous route. Next, disadvantages might lead to abscess formation and absorption is limited by the blood flow. So that means giving the medicine through this route often leads to the formation of abscess and absorptions of the medicines through the blood flow is limited by this route. Next is intramuscular route. Applied to the buttocks, thighs and deltoid, the volume used 2 to 3 ml. Intramuscular route might be used on the buttocks, thighs and deltoid muscles to give the medicines by injections into the muscles, and we should take the liquid form of medicines from 2 to 3 ml in the syringes to administer that medicines. Advantages: absorptions is rapid than the subcutaneous route, and next is irritate substance might be given. With the help of this route, the absorptions of good as compare of the subcutaneous routes and irritate substance can be administered through this route. This is a good method to give the irritant medicines by this route. Next is disadvantages. This route might cause the nerves or vein damage because if we can give the medicine of the irritant, then it will cause the nerve or vein damage. When we give medicine in this way, there are chances of the damage to our veins or nerves. Next, intravenous route. Fluid is directly delivered into a vein. In this route, fluid medicines is injected into our vein, that is called intravenous route. Advantages: immediate actions takes place. Absorption is not required. This route is preferred for the unconscious patient. Medicine given by the intravenous route are quick in action. So there is a no need for the absorptions because medicine is entered directly into the vein. And the next advantages is that this route is also helpful for the unconscious patient. Disadvantages: more risky, no retreat, inflammation of surrounding tissues. This route is considered very risky because when the medicines enter into the body, it becomes difficult to recover the retreated, and it will result inflammation of the surrounding tissues if we can give the incorrect way of the medicines by this route. Is intraarterial route. Drugs are administered into an artery. Anti-cancer drugs are given for the localized effect. In this route, drug is administered through the artery. This route is also used for the anti-cancer drugs so that to show the localized effect. Advantages: bioavailability is 100%, high concentration of drug can be administered. So it's a bioavailability is 100% because medicine reaches the site of the tissues and then show its reactions, and we can also give the high concentrated medicines through this artery, and then we can get the action. Next is disadvantages. It's a painful, less safe, and expensive. This is a painful route. It is an unsafe method and it is an expensive way to administer the medicines through this route. Next is intradermal route. Drugs are administered into the dermal layer of the skin just beneath the epidermis, and it is a small amount of liquid is used, for example 0.1 ml. In this route, medicines are injected into the dermal layer of the skin just next to the epidermis, and it is usually given by the small amount of liquid medicine, and from 0.5 to 0.1 ml solution is injectable through this route. Next is advantages: slow absorptions. This test is used for the tuberculosis and allergic test, which is very slow in absorption. Next, disadvantages: amount of drug administered must be small and it is expensive. In this route, medicines can be injected in small amount and this is quite expensive, as a doctor or nurse is needed to administer the drug by the intradermal route. Next is local route. First, skin topical. Topical drugs is applied to a specific locations or a body, and it is also used to treatment of the disease on body surfaces like skin and mucous membrane. Some topical medicines like creams, foams, gels, lotions, and ointment might be used. Second local route is ocular drops. In this, drug is administered in the eyes, but they must be instilled correctly because it is a very sensitive organ of our body. Next and last route of the local is intranasal. Nasal administrations is also known as the sniffing because it is a route of the administration in which the drugs are administered through the nose. So this is all about the types of drug administration.